Have you ever walked into a room and forgotten why you were there? Or maybe you've misplaced your keys and joked, "I must be getting old." While occasional forgetfulness is normal, persistent memory problems could be something more serious, something many people ignore until it's too late. In this video, we'll talk about what dementia really is, why it happens, and how to recognize the early warning signs. Before it affects daily life, understanding dementia can help you protect yourself or someone you love. Dementia is not a single disease. It's a general term used to describe a group of symptoms that affect memory, reasoning, and social abilities severely enough to interfere with daily functioning. It's caused by damage to brain cells, which disrupts the way your brain communicates. When brain cells can't send messages properly, thinking, memory, and behavior begin to change. There are several types of dementia, including Alzheimer's disease, the most common type, responsible for around 60 to 80% of cases. Vascular dementia, caused by reduced blood flow to the brain, often after a stroke. Lewy body dementia, involving abnormal protein deposits in the brain. Frontotemporal dementia, affecting the front and sides of the brain, often leading to personality changes. Mixed dementia, when multiple types occur together. Each type affects the brain differently, but the result is similar: a gradual loss of mental ability that impacts memory, communication, and independence. Dementia can result from a variety of factors, many of which are related to age, genetics, and lifestyle. Common causes include age. Dementia is most common among people over 65, but it's not a normal part of aging. Genetics. A family history of Alzheimer's or dementia may increase risk. Head injuries. Severe or repeated head trauma can raise the likelihood of cognitive decline. Health conditions. Diabetes, high blood pressure, and heart disease can damage brain blood vessels. Lifestyle factors. Smoking, excessive alcohol, poor diet, and lack of exercise can also contribute. Scientists believe that a combination of genetics, environment, and lifestyle choices all play a role in how the brain ages and degenerates. Dementia doesn't appear overnight. It develops slowly, often starting with subtle changes that are easy to dismiss. Here are the 10 early warning signs you should never ignore. 1. Memory loss that disrupts daily life. Forgetting recent events or names and relying heavily on reminders. 2. Difficulty planning or solving problems. Trouble following a recipe or managing bills, tasks that used to be easy. 3. Confusion with time or place. Getting lost in familiar areas or not knowing what day it is. 4. Trouble understanding visual images. Difficulty judging distances or recognizing faces, which can lead to accidents. 5. Problems with speaking or writing. Struggling to find the right words or repeating the same stories. 6. Misplacing things and losing the ability to retrace steps. Placing items in unusual spots, like putting keys in the fridge and then forgetting where they are. 7. Poor judgment. Making bad financial choices or neglecting personal hygiene. 8. Withdrawal from work or social activities. Losing interest in hobbies or avoiding social interactions due to embarrassment. 9. Changes in mood and personality. Becoming easily upset, anxious, or suspicious without clear reason. 10. Difficulty completing familiar tasks. Struggling to cook, drive, or use household appliances once mastered. It's important to note that these signs can appear in mild forms long before a diagnosis. Recognizing them early allows families to seek help and slow progression. The human brain is an incredibly complex organ made up of billions of neurons. In dementia, these neurons are progressively damaged and die, leading to shrinking of brain tissue. In Alzheimer's, for example, 2 abnormal structures, plaques and tangles, build up inside the brain. These disrupt the communication between nerve cells, leading to memory loss and cognitive decline. As the condition advances, the affected brain areas expand, causing greater difficulty with speech, movement, and personality control. Many people assume that dementia is simply getting old, but that's a dangerous misconception. A proper medical diagnosis is essential. Doctors use a combination of tests, such as memory and cognitive assessments, brain imaging, MRI or CT scans, blood tests to rule out other conditions, interviews with family members for behavioral history. Early diagnosis helps patients and caregivers plan for treatment, make lifestyle changes, and improve quality of life. There is currently no cure for most types of dementia, but there are treatments that can slow progression and ease symptoms. Common approaches include medication. Some drugs may temporarily improve memory or mental function. Therapies. Cognitive training, memory exercises, and social engagement can help maintain mental sharpness. Lifestyle changes. A balanced diet, regular physical activity, and mental stimulation can all support brain health. Researchers emphasize the concept of brain resilience. The idea that keeping your brain active, healthy, and socially connected can delay or prevent symptoms. Although we can't control age or genetics, we can influence how our brain ages. Here are practical steps. 1. Stay physically active. Exercise increases blood flow to the brain. 2. Eat brain-healthy foods. Include omega-3s, fruits, vegetables, and whole grains. 3. Sleep well. Poor sleep affects memory and brain repair. 4. Challenge your mind. Learn new skills, read, or play strategy games. 5. Stay socially engaged. Connect with friends and family regularly. 6. Manage chronic conditions. Keep blood pressure, cholesterol, and diabetes in check. 7. Avoid smoking and excessive alcohol. These steps don't guarantee prevention, but they significantly lower your risk and improve overall well-being. Caring for a loved one with dementia can be both emotionally and physically challenging. Here are key ways to help. Be patient and compassionate. Frustration won't help. Empathy will. Establish routines. Predictability reduces anxiety. Encourage independence. Allow them to do tasks safely on their own. Use clear, calm communication. Simple sentences and a soothing tone work best. Take care of yourself. Caregiver burnout is real. Seek support groups and rest when needed. Remember, the person with dementia is still the same individual you love, even if their memory fades. Beyond the medical side, dementia deeply affects relationships. Families often feel grief, confusion, and helplessness as their loved one changes. But awareness and understanding can transform fear into empathy. By talking openly, reducing stigma, and seeking help early, we can make life more meaningful for those living with dementia and their families. Dementia is one of the most challenging health issues of our time, but it's not something we should fear in silence. By recognizing the early signs, understanding what's happening in the brain, and supporting each other, we can make a difference. If you or someone you know is showing symptoms, talk to a healthcare professional. Early action can help manage the condition and improve life quality. Let's raise awareness and bring hope to millions of families around the world. If this video helps you understand dementia better, please like, share, and subscribe for more health education videos.